If your son or daughter has Kohler's disease of the foot, what is that and how can you help them get better? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. All right, Kohler's disease is much like what we talked about in a recent video when we talked about Sever's disease. This isn't a disease per se, and it's not a traumatic injury. This is something that builds up over time. Again, this is almost always young kids, 8, 9, 10 years old. Unlike Sever's disease, which was an inflammation of the growth plate of the heel bone, this is typically an inflammation of the growth plate of the navicular. That's a bone in the arch. You can see this on the inside of the foot. There's the arch, and it's this bone here. And there's a lot of stress, a lot of force that goes through that bone with running, with jumping type of activities. So typically this is going to manifest as sort of this nagging pain, goes away after practice, then the next day or a few days later, maybe it lasts, it comes on even quicker, takes a little longer to go away. Then starts coming on earlier and earlier. Practice even starts getting where it's really difficult, really taking a long time to go away now. Starts to hurt when they're walking and going upstairs and things like that, and really causes limping and lots of issues. Fortunately, it almost always gets better without surgery. That's going to be a little bit of a time out of sports for sure. A few weeks to rest the foot. Maybe we put them, as orthopedic surgeons, put them in a boot if they're really struggling to bear weight without pain. But usually time alone will get this better. This is not something that typically needs surgery. Again, this is a diagnosis of young kids. So you go see an orthopedic surgeon, they get x-rays, combine the x-rays with the exam, you can almost always figure out what the problem is. Occasionally, we might get an MRI if we're potentially worried about another injury and make sure that we know exactly what we're up against. But again, usually fairly straightforward. Usually heals pretty quickly actually, and then you get back to sports with no lingering issues. If this video is helpful, make sure to click the video below for much more helpful information on sports and exercise injuries. Make sure to subscribe, and I look forward to seeing you in our next video.